So this program as a whole was developed. We've been working with VHA prior to Vizient. Now we're working with Vizient on these topics of really understanding how executives fit in and can support and drive and lead safety and quality efforts. Historically, a lot of our success has been bottom-up, engaging frontline providers in understanding risks and managing risks and taking ownership of safety and quality. But really, to make large-scale change happen, there's a balance. And it's difficult for executive leaders. In our experience, it's been difficult for them to understand what a good strategy is or should be. And from the literature and our experiences, this is a simple framework that covers a lot of the territory. Clearly not all. The scope and breadth of what leaders need to manage is overwhelming. But by focusing on the sense of collective accountability, and that do the people that work in our organization have this sense of responsibility, contribution, and control over quality and safety improvement efforts. If we can say that definitively and positively, then we've gone a very long way in instituting a strong organizational approach to safety and quality. So responsibility, do people understand what their role is in managing risks and ensuring quality? Do they feel like they have an ability to contribute to those solutions? Do they have the skills? Do they have the ability, the learning mechanisms in place to do a good job? And then do they have control? So if we're talking about improving safety and quality, we're talking about changes. Do people feel that they can make the changes that they need to resolve the issues and see improvement? And we found that that breaks down very easily, and it breaks down in pretty predictable ways, but there's some management and leadership strategies, again, that we can put in place to do that. And we're going to hear, I think, some examples of how some of those were enacted in ambulatory care this time. But there's things you can do to improve people's sense of responsibility, their role clarity. What is it that they're responsible? We can give them better feedback on how they're doing relative to those goals. And we can have some types of escalating review or some type of predictable and transparent response when we are or are not meeting our goals. And then there's things we can do around capacity building. Have we given people the skills they need to understand safety risks and quality breakdowns and the tools they need to be able to fix those problems? And then, of course, there's time and resources. Do we transparently allocate our people power and our financial resources to our priorities in a meaningful way? And then on top of that, we need to be good leaderships. We need to engage good leaders. We need to engage people intellectually. We need to motivate them. We need to have meaningful conversations with them. So those are where we focus and where we try to pull the pieces of our program together to have a coherent strategy. And our program started this year in January and February. We heard from Dr. Pronovost, who is our Senior VP for Safety and Quality, as well as Director of the Armstrong Institute for Patient Safety and Quality. And he helped us really understand the broad landscape, the history, the Hopkins journey over the past 10 years, and the Armstrong journey over the last 5 years. And we introduced, as we said, the assessment tool so we can get some kind of benchmark, some idea, some reference point of how we're doing. And then we also introduced a tool around that role clarity, aligning goals, responsibility, and feedback piece. And those are available on the Vizient website. Now we're really excited in this kind of mid-phase, which we're starting today with our talk from Jennifer Bailey and Steve Kravitz, is to look at those same ideas around safety and quality improvement and leadership and management from lots of different perspectives. We're all working on this. It really is a time to innovate and try to understand what's working and share and learn from one another. So we're hearing today from people involved in the ambulatory setting. We'll be hearing next Monday from Charles Ruland, who's our COO, of one of our affiliate hospitals, the Bayview Medical Center. And not too long after that, Chip Davis and Redonda Miller, both from a community hospital perspective and then from a physician leader perspective within an academic medical center. And then we're all leading up to the final phase, which we'll be able to give more details on soon, but an in-person leadership retreat here in September, the 12th and 13th, where we'll have some really fantastic thought leaders, both from healthcare and outside of healthcare, as well as a lot of time to connect with like-minded individuals and share and build something in some really interactive workshops. And leading up to that, we'll hear from Dr. Kathleen Sutcliffe, who really is a thought leader from the management world on high reliability organizing.